Hello and welcome to another episode of Child Rights Now. We are discussing issues children in Kenya and across Africa. My name is Colin Sorono, and joining me today is Mr. Elijah Bonyo from Joining Forces. And last week we were with him here discussing dissecting issues data in Kenya in relation to children issues. And we are also being joined by Amy Kemper from Miss Coach Kenya. Karibu sana, Amy.
Thank you very much.
Yeah, maybe you briefly just tell us about what is Miss Coach Kenya as we start.
Thanks, Collins. As you said, Amy is my name, and I'm happy to be here on Child Rights. Miss Coach Kenya is a non-governmental organization, an organic, grown, local NGO that is working within the informal settlements of Korogosho and its surroundings. Started way in 2001 on matters children and safety for girls within the expansive informal settlements of Korogosho and its environs on safety issues, child defilement, and rape among women. And so that's the time when Miss Coach came to birth.
Wow,
yes.
That's amazing. So it will be unfair for me to ask you about Miss Coach Kenya and I don't ask about Joining Forces. I know we sing about this, and for a person who listening, who is watching for the first time, Bonyo, briefly tell us about the Joining Forces.
Yeah, thank you very much, Collins. Joining Forces for Children is an alliance of 6 organizations. This is a global alliance. So we have World Vision, we have Plan International, we have Save the Children, we have Child Fund, and then we have Terre de Homes and SOS Children Villages. And all these organizations are also in Kenya. So in Kenya we have World Vision as a lead organization for the Joining Forces Alliance in Kenya. And right now we have a specific project we're implementing as Joining Forces, but now sometimes we hear a word JOFA. JOFA is Joining Forces for Africa. There's a special project funded by European Union that makes us also join this discussion today to be able to share what we're doing, especially around data on children. Thank you.
Wow, that's amazing. So yesterday, the world was marking the International Day of the Girl, and I believe it's the whole of this week. I want to hear from you guys briefly. What's the state of children or the rights of girls in Kenya? Let me start with you, Amy.
Thank you very much again. Just talking about girls also is like my heartbeat, because that's where it all starts. And as for the statuses of girls in this country today, the trends are sometimes worrying because one, COVID-19 brought in a lot of unresolved issues. And these unresolved issues are teen pregnancies. As we speak and where we are at as a country, I would say everyone should put their things to a halt just to look through what is happening with teen girls especially. So we have more teen mothers also, but as you've said, it's about data. This data can be collected from the Ministry of Health, where teen motherhood or teen pregnancies are being registered. But again, we put the figures to the people. So at times we assume there is data, there's no data about these girls and where their whereabouts. And as the world is celebrating the Day of the International Girl, it's also worrying that the trends that we were advocating for early in 2000, for girls going back to school and safety for children, is also wanting, because who are defiling these children? As the trend is, there are not many of them who've gone back to school due to teen pregnancies, and so they are at home. What are we doing about the issues that are happening around the girls? and most of the young girls and children as young as 9 years, as young as 10 years, as young as 12 years, being called a mother.
Wow, right. Someone was telling me that sometimes we as a country or we as a people focus more on the defiled and we forget talking about the defiler. Let me ask you, Don, what's the state of the rights of the girl in Kenya according to you?
Thank you, Collins. I think for me, we need to look at the child from a male and female perspective, and also we need to remember now we have intersex as another category that we need to look at. The 2019 census has given us very good numbers. I think we have 49% of the children are girls. I think 50% are boys, and then 0.03% are intersex. Now that's government generated data. Then we need to look at male and female children across age groups. When we have a baby, we normally refer to them a baby boy or a baby girl. So what are the needs of the baby boy? What are the needs of the baby girl? And how are we progressing? That's for me is where most of the time the challenge begins. Because unless we get families or parents or caregivers that are well empowered, adequately empowered to take care of their baby boys and baby girls, then you get to a situation where when we get these children get to the level of primary school, you begin to see some inequality between the boys and the girls. And where do this inequality begin? I think these inequalities begin right from what people experience at the household level. If you don't ensure that at the household level, children begin to appreciate that we have male children, we have female children, and they appreciate their entitlements, then you go to the primary school, then you begin to see an element of inequality which are gender-based, right? Fast forward to where we are today as a country, I think we are doing very well in terms of ensuring we achieve gender parity, especially in education. But where we need to do more is provision of the basic things that the girls require. Like Amy says, one of the challenges is access to sanitary towels. And it is true that a number of girls, adolescent girls, require sanitary towels, but their families are unable to provide for them sanitary towels all year round. So there were efforts around ensuring that sanitary towels is provided by government to all children. So what happens is that the Basic Education Act was amended to include a provision that government will provide that as part of the education package, right? But we are still not seeing that being done. So if you look at the budget, not many girls are accessing sanitary towels through schools. So the question is, as we talk about the International Day of the Girl, if all the children in Kenya today, all the girls who require sanitary towels said that today we are not learning until we are provided with sanitary towels, will learning continue? Go to any school and maybe in a particular school, 50% of the girls could be having sanitary towels and 50% are not having. And then they say, those who are having are saying, today we will not learn until all the girls in this school get sanitary towels. Will learning continue? And you can imagine, you're in class and you know clearly you are not going to have sanitary towel the next month. Will you really learn? Thank you.
Wow. Now, those are the areas that we should really think about, even as we mark these days. Now, let me hear from you, from your own perspective. How important are these days?
Wow. I would say International Day of the Girl is a day that should be appreciated by all, and by all states. I would say if governments would just realize the importance of these children, that at times, quote unquote, you may neglect, and saying their future is tomorrow, when you're not building their future now, it is just a paradox. Because how are we building a nation where the champions for it are not even, realized? But we are appreciating the small strides that the institutions are making, the government institutions to be precise, and also focusing on the children, and also giving them enabling environments where, all their rights can be protected, secured. So looking at some of these small steps, we'll say we are appreciative because one, there is access to education. Two, there is access to affordable elements, but which are not really there. But how can they be more affordable to the children in the informal settlements or in the rural areas who cannot access the needs, like sanitary towels. I would say they are the most common basic needs. But case in point, children in Pokot or Turkana will stay away from school or will go use the sun just to, ease their time. But it is important to tell these girls that when you're having your menses, it is an important period for you at that particular time. You should cherish it and appreciate it. But you find we are not even appreciating it. And I would wish that as the government is trying to make strides into, giving us equitable resources to support girls, also they should also have a package for the young boys as well. Because when you go to school and give sanitary towels, the boys will ask, and how about us? Who is caring about us? They don't have boxes. They don't have vests. They don't have socks. There are small things that reduce our self-esteem. If I saw you today as a girl, I will not move to go there. I'll wait until everyone clears the room so that I get the confidence of standing up and checking around and, looking at myself and say, okay, should I go or not go? Should I go when it's almost dark so that no one laughs at me? Because it's a stigma in itself. So if our caregivers who are doing a lot to support girls, and also our parliamentarians who should make sure that, I wonder how somehow condoms are free, but sanitary towels are not free. Yet it's a most basic need for that girl who is in that particular school and who might not afford, because the least that you can get a sanitary towel is about 80 or 60 shillings. Case in point, I've lived in Korogosho and I've seen how life is in Korogosho. A meal a day, a parent or a mother, a single mother or a single-headed family or a child-headed family, they are just looking for a 50 shilling coin to go buy food. Sorry, will they get the 50 to add on the necessities that the child needs? So where are they left?
That's an interesting question. So, Mr. Bonyo, now she has mentioned all that, but I think numbers are very important in informing decision making in all these areas. And the question that I have for you is, okay, how is data on children being collected in Kenya? Because there was some time when COVID started, there was a huge discussion, especially on the issue of teen pregnancies. And the discussion was the numbers were not as they were projected. And, there are also arguments that, these people are hiking these numbers because they're looking for funding, they're looking for donor money and all that. How do you guys collect this information?
Okay. Let me go back to build on what Amy is saying in terms of numbers. Ideally, all girls in need of sanitary towels should be in school, if all of them were in school. So it means that through the school system, we need to know how many girls are in school, and out of those in school, how many need sanitary towels, for example. So the school system is one of the platforms where we're able to get the right numbers. So we need to ensure that everyone is in school. Because if everyone is in school, then it's very easy to collect the numbers through school. But where do we have to struggle with the numbers anyway? If I normally say that the government every day knows how many people are being born, right? That's why government plans for birth registration. And government plans to print birth registration certificates. And they're planning with the numbers. Government plans to print birth notification. So when you're planning to print birth notification, you know you are planning with the numbers. So when we have children, government can tell us how many children are born every year, right? The same government can tell us how many children in school. And the same government can tell us how many children are not in school, right? So the civil society on the NGO sector, most of the time, we rely on government sources of data. But what happens is that over the last 1 year, many organizations ended up looking for their own data. And you could hear Group 1 talking about some numbers. When you ask them their sources, they struggle to reveal their sources. Group 2, talking about some numbers, they struggle to give their sources. So we need to appreciate that if the government system was working well, then we could have one central approach to data collection. The Department of Children's Services should actually be having a comprehensive data collection tool so that not every NGO is developing their data collection tool. So when you have a comprehensive data collection tool that takes all the parameters, then as a non-governmental organization, then you can take that tool to facilitate the process of data collection, right? Now, who should be in the community to collect the data? In the community, my view, I think the community health workers, because they visit all households, are able to collect data on children from the household level. But children who are not in the community, they're in the school. So I see two processes here, the community getting data, community health workers getting data from households, and teachers getting data from schools, and we are sorted.
Oh, yeah. So you mean that is not happening currently?
It's not happening. It's not happening because of various challenges. The community health workers are not readily involved in data collection because no one has organized them in a manner that they'll appreciate that collecting this data regularly is important. Number two, the tool for use for collecting data, they largely collect data that is specific to health indicators, but they hardly collect data on other parameters.
All right. Well, yeah, I know maybe someone might argue that, you know, data is a bit a technical issue to maybe engage community health workers. How would you comment about that?
All right, I'll say because we've tested, and of course we've used the community as health workers, and okay, we call them community health volunteers. They're no longer health workers, but okay. So when we're using the CHVs, is you have to look at their competencies, but also who should build the competencies of the people you want to support. Also, it's what Bonnie is saying, that you need to build around them a mechanism where when they are collecting data on matters health, they can also collect data on matters social economics. So just the same way you're trained, like when censuses is being carried out by the government from the statistics, you know, they train the people who are going for, you know, data collection. The same thing applies. It's not a shortcut because you have to understand the tool, what Dawn is talking about. You have to understand, even just, you know, coding the name, or if it's the years, how you have to record them, and how to record, you know, by sequence of events. So sometimes when you don't really go to some sort of a formal guidance, you might not be sure of how you're, you know, collecting what you want to collect and if it might not give you the right results. So it has to be that's why it's systematic. It is just not for everyone to do data, yes, but it has to be scientifically proven by use of, a system. So, and when you have research scientists and research assistants, so when you have a research scientist, they will help us in terms of how to collect this data, and the research assistants will be able to follow through the procedures, because it has to go through a certain procedure. You cannot just jump the gun. Yeah. And so when you validate the data now, the policymakers can really look into it and say, yeah, this is correct data that we have for this area X. So as we're talking right now, we've engaged the CHVs and who did the work through minimal supervision, and also aided by the Children's Service Department from the Kasarani sub-county. So you find that you have to get the right persons to take us through the tool, because sometimes we don't have the tool, but the government has the tool. The government has every tool for any research. It's only now getting the right person for that particular one.
Wow, interesting. So guys, let's go for a short break. When we come back, we shall be delving deeper into this discussion. We shall be looking at the best practices around data collection, things like the challenges that you guys face in collecting data in relation to children. Keep tuned in. We shall be back.
I want to welcome you on behalf of the Vice Chancellor of this university and even on behalf of our Senate. I'm welcoming you to attend the conference on the ECD network that will be held and hosted by this university on behalf of Siaya County on 25th October 2021. This will be the fourth ECD network conference, after the first and second one having been held in Kenyatta University and the third one having been held in Mombasa. We are proud to be associated with the fourth hosting of this particular conference.
All right, welcome back. This is Children Rights Now. We are discussing issues children in Kenya and across Africa. And today we are talking about data and the methods of data collection and how important is data in decision making in relation to children. And we are discussing with Mr. Elijah Bonyo from the Joining Forces Alliance, who is at my far right. And we have Amy Kempaf in the middle from Miss Coach Kenya. Karibuni sana. And I'm very happy that this conversation inashika moto. So I want to know from you guys, how is data collection in Kenya? You just mentioned a brief about how you involve CHVs at the community. And I just want to know, like, how is it like involving community health volunteers in data collection? Let me start with Elijah Bonyo. If you've ever had any experience with data collection and as an organization, the Joining Forces, that is.
Yes. There are situations where community health workers have been very helpful in getting data on children, and then there are situations where it has been the village elders, and there are situations where it has been the schools. And it depends on who is collecting the data for what. So in the non-governmental sector or the private sector, people collect data based on certain interests. And you notice that community health volunteers are not in the official government payroll. They're not, whether you call them community health volunteers or whether you call them community health workers, they're not on a monthly salary. So anytime you want to get information from households, there's some financial investments around the process. So literally have to compensate the community health workers or community health volunteers for that process, and they get the data that you want, especially if that data is not specific to health. If you go to the village elders, equally the same thing. So what our experience has been that if we can consider strengthening the local office of the assistant chief, so that anyone who wants information specific to a sublocation, then you just go to the office of the assistant chief and you get all the information you want. And the office of the assistant chief should be able to collect information or data continuously, so that it doesn't have to be an NGO who wants to do a particular thing and then they go for looking for data that they want to do what they want to do. Remember, children's rights are well provided for in our Constitution, Article 53. And government plans for all children. And government plans based on numbers. And government information is available at the village level. I like mentioning the census report because it is giving us information up to the sublocation level. The census report is giving us the number of households in every sublocation. So if you want a number of households, it's already available. If you want number of children, it's already available. So if you want numbers on situation of children who are at risk or in need of certain services, that's when now you go and collect more information, because the risks keep on emerging that then will warrant that certain needs are addressed. For example, if you want information on child labor, if you go to the office of the assistant chief that you are concerned that this area we could be having child labor, then the assistant chief can then commission an immediate data collection exercise around that child labor issue, because maybe over the last 1 year the data was not on child labor. Another time it could be around child neglect. But you see, if you got a tool that has all the parameters, you know, in this country, several children are categorized as children in need of care and protection depending on certain risks that they're prone to or the needs. So if you got a category of data collection tools known as child protection data collection tool, which is available, by the way, with the Department of Children's Services. So if you got that to the chief's level, so the chief does not have to wait for an occurrence for them to collect data. Then they continuously say, we have this number of neglect in January, we have this number of neglect in February, we have this number of neglect in March, and they're able to demonstrate whether the intervention are reducing the numbers of neglect. So the key thing is that let us strengthen the office of the assistant chief. Remember, the National Government Coordination Act of 2013 clearly indicates that it is the assistant chief and chief that will coordinate national government functions at that sublocation level, right? Mm-hmm. Whose function is it on statistics?
Wow, that's an interesting
national government.
Yeah.
Do you realize no county government has their own separate statistics unit?
Yeah.
Because we are relying on one central statistics unit, and in this case we rely so much on the National Bureau of Statistics, or Kenya National, the one who said Minister of Planning. So what we need to do therefore, if we look at data collection, not analysis is another matter. Data collection as a function of national government centrally, then we empower the office of the assistant chief to ensure that all the data that is required is collected. Then any actor, whether NGO, religious organization, or civil society, or whatever you want to call it, whether donors, you are able now to go to the database and analyze what you need. So let us separate analysis and collection.
Okay. Let me hear from you, Amy. Do you have an instance where maybe you participated in a data collection exercise? Just briefly give us what was it that you participated in or you were in charge of, and how did it turn out? What are the challenges?
Wow, interesting, because I participated in the 2009 census data collection for the government. And of course, there are some resistance to data. When it's people feel you're investigating on their lives. Yes, it's an investigation, but it should be given upfront that one thing about data collection is you have to be honest about what you want to collect on the people, because it's not that you've given them awareness that will be coming to your house for data collection. And I remember during the 2019 censuses is when Minister Honorable Matiang'i was telling everyone to be at their spaces and not leave, to be there. And, the data that is being collected is for the government purposes of planning. But then when it comes to like the socioeconomic statuses of, data collection, as what Bonio is mentioning, is that you've not created awareness around it, because it's not a national censuses. If it's national censuses, it's given the national outlook that it befits, with a lot of awareness around it. But when we're doing an internal kind of just situational understanding of different age, case in point, we are doing teen pregnancies. Yes, from the Ministry of Health, because teen girls will walk into the clinics for the antenatal cares, and they'll be like, they have to be examined, they have to be asked, when did you last have your periods? But you see, when you're coming to the household, you'll be asking, what do you use in terms of your cooking? And also, so this is like almost personal investigation. So people will be asking, why are you asking me? Are you going to buy for me what I don't have? Do you use stove? And if you're using stove, how much are you using on fuel? So some of this, data is about, continuous questioning.
Yeah.
And, going to the hospital is just like, get my blood pressure, they get my vital signs, and bingo, easy.
Yeah.
At times it's just like, go to the lab, let's get the test for your urine. So if they test my urine, bingo, pregnancy, right? But at times it might go without really asking. But after the doctor has done his investigation, or investigation should give you a result, your report. But hence, when you're going to a door-to-door, I have to ask you, do you have shoes? But I'm seeing you with shoes. I don't need to assume, right? So there are some questions that might seem rhetorically wrong being asked, but to a certain ascertainment,
Yeah.
it is important to say, even if you see me with my shoes, I borrowed. You might have gone for, say, case in point, Arurasho, you wanted to look good for a certain meeting, function. So si utaomba viatu. And when you borrow the shoe, is the shoe you as though you're having borrowed shoe, or jackets or dress. I know we've lived in a scenario where you're going to you see your relatives, or you want to suit in a certain way.
Yeah.
Then you have to borrow something.
Wow. So let me stop you there,
Yes.
and go back to Mr. Elijah. She has mentioned something here about data collection, and it seems easy to get data in relation to other things like teen pregnancy and those other things related to children, because it seems to be easy to get that data compared to getting that maybe the one that is usually done by government at the national level. Now, what could be the challenge in terms of putting that information together?
Yes, one of the challenges we have is several systems of data collection. For the health sector, you'll have the Kenya Health Information System as a system. For education sector, you will have the education system, the National Education Information Management System. When you go to child protection, then you have the Child Protection Information Management System. Now, remember, these numbers are collected at the point of service delivery. look at children's rights from this programming and the service delivery, government service delivery. For health, with the moment the mother goes to the facility, they have gone for services. So health service delivery, we will pick health service related data. How many people came to the facility and for what? When you go to education service delivery, you will pick education specific data, how many people came to schools and for what. When you go to birth certificate, you will pick people registered to get birth certificate, right? Then the child protection one oftentimes is about data on reported cases of children in need of care and protection. Now, before someone is identified as in need of care, the person could be suffering and nobody knows the numbers of many people suffering. That is why you realize that people are going without food. You are likely not to know that people are having no food until the person comes to the health facility. Then you realize this is a problem resulting from lack of food at home. You will not be able to know that people are not having food until children are not coming to school. Then you find out and realize there's a problem of food. So, but why would you want to continue going to households to ask people, did you have food or not? Why don't you just use the numbers from the different systems and make sense out of them? Meaning there's some system analysis issue that should happen. If for example, just a second, if for example the health sector is showing at a particular level, sub-county level, the health sector is showing a trend of malnutrition, right? The health sector then needs to communicate to the food security department to intervene on strengthening household food security. So the data for the health sector in terms of nutrition indicators should be utilized to feed the food security agricultural sector or livelihood sector to support immediate interventions. So that's part of the challenge that is not easy to deal with unless the system issue is sorted out.
So would you say are we assuming too much as a country?
I think we're not assuming, we're simply not doing the right thing. You know, what we are saying here is already known. And go to these sub-county offices, you get the right minds that know what to do. But all the time is a question of we don't have funding. And sometimes you ask yourself, is there anything we can do without funding that you don't rely on the fact that the person, you already hired and you're on salary. So is there anything you can do with your time because you're on salary? And then what else do you need funding to do? Because some of these things is human resource requirement as opposed to capital intensive issues. There are more software issues. You can imagine you have hired people, they're on salary every month, right? But doing an analysis, it's not done. Now, if you're not doing an analysis, it could be you don't have the capacity to analyze, or you're simply not doing it. Because why would I be in the health sector? You are in the education sector, you are in the agriculture sector, then you have the sub-county stakeholder meeting, and you're not doing an analysis. Then what we go to the meeting to discuss how to address issues of children based on the information. So as I present my data from the health sector, for example, she presents from education, you present from food security, then we discuss, what does this mean for us? What can we do? Now that is not a funding issue. That is just a mind issue of people being available to meet. So let us separate. I get uncomfortable when all the time we keep on saying we can't sort out data analysis, we can't sort out this because of funding. Let's talk about other things. Let's talk about we need more money for food security to make families strengthen their kitchen gardens and stuff like that. We can't say we need money for a workshop to go and analyze data.
Now, Elijah, speaking of the same, we can't do this because of funding. Now, why can't you guys come and take over that or partner with government to get that data in order?
Now Collins, like I said, we are speaking, you asked a very good question. What are some of the challenges we are seeing? What are some of the lessons we have learned? And what are the best practices? So you have seen these challenges, And some of the things we are telling you here, and I've worked with Amy before on a number of things, so some of the challenges we are telling you here, we keep on presenting these challenges to the right duty bearers and solutions. Now, let me explain again. I want to, just give me 1 minute. I want to explain this, what we are saying. These things should be fixed at the local level. The issues in Nairobi informal settlements around children are sort of different, and we've done a study on this in the Joining Forces Child Protection project that I talked about. It is a component that we're implementing in Nairobi informal settlements. It has a component that we're implementing in the rural areas. It has a component that we're implementing in the refugee setup. And as we engage with stakeholders, you begin to see that this context, the data collection tools might be the same, but the analysis, what you're analyzing and making meaning out of it, is very different. In the urban informal settlements, you don't have big farms where you will tell people, let us go to our farms. Then what do you do in urban informal settlement? You adopt the urban, it's called urban farming. You adopt the urban farming. In other parts of the country, you need to adopt another type of farming. Now, those discussions is what will sort out the food security, reduce malnutrition, encourage more children to go to school, and reduce the number of children in need of care and protection. Right? Now, we have gone to these platforms to discuss this. You are asking us, can you take over? We are not government. We can't do the work of government.
Now the government, okay, let me say, the government tells you, or most of the time, the way you say the challenge is funding.
Yes.
Now, why can't you guys partner with government and tell them, yes, if the challenge is funding, then let us chip in, or let us work with you, we get this data in order?
Maybe Amy can make a comment, but I think for me, let us respect the duty of government first, acknowledge it, and let us remember people are paying taxes. Let us remember it's the duty of government to do what it needs to do. And when you talk about partnership, who is partnering with who, and for what? And for what interest? Now, unless you want us to go to another topic called collaboration and partnership, partnership with government is another matter. And why would you want to partner with government anyway? For what reason? It means there are certain push factors that will bring you as a non-governmental organization to discuss partnership with government, and then it means something else. I see it. So from the non-governmental sector, partnerships with government are driven by certain things.
Now that you are not able to partner with government.
I didn't say we are not able to partner with government.
We are partnering.
Maybe Amy can explain better.
Okay.
What Don is saying simply is we are in a way working with the government. You cannot work minus government in being involved in your work. That's one. So the only thing is we have to have the duty bearers also taking a stake. And how, as a citizen here and you as one, we have to come together and ask, you are taking tax from me. What are you doing with it? Is it making more schools and safe spaces for more girls or boys who are being mistreated, maybe in certain quarters? Case in point, we have a few centers where we can take boys or girls who are being mistreated or, going through child labor. But if we don't have safe spaces for both boys and girls, then it means our taxpayers' money is not being utilized as we're supposed to. We have to front for all these services, some of which it has to be taken head on. But they are coming in 2022, right? We have to hold them by their tails. This is what we want to achieve. They come with their manifesto. You say, no, put your manifesto aside. This is what our manifesto looks like. The children needs on safety and protection is not being felt here. What are we doing?
And let me tell you why this issue of partnership is critical. You know, partnership is not about plans and what to do together. It's also about resources. Now, why is it so difficult in this country to say that children in where Amy works, in Korogocho, for example, for us to sort out the needs of children in Korogocho, we need, say, 10 billion. Why is it so difficult for government to say, Korogocho, looking at all the budgets we have around Korogocho, we need 10 billion, but we have 6 billion. Now, we are looking for partners who can help us with a deficit which is 4 billion. What are we doing? The language is partnership, partnership, with no financial details on the table.
So what
we must talk about partnership beyond planning and talk about partnerships with the budgets on the table. And government should be putting more.
So have you tried this before?
As we are seated here, Collins, we are from a journey of many years of lessons learned.
What are some of the lessons?
Lessons learned number one, don't get into partnership without discussing money. That's what I'm saying. I'm emphasizing this. Don't just discuss, we want to construct classrooms. We want to provide training for women empowerment. We want to provide rescue centers. Don't go that route. Start by what are the needs in this area? What is the cost of addressing these needs based on the interventions? Ministry of Education knows, for example, the cost of supporting free primary education in the entire country, and they have a deficit. So if you want to intervene on education, for example, pick what is the deficit, which part of the country, and bring the partnership discussion around, this is a deficit. But what are non-governmental organizations doing? Every NGO is planning in their own corner. Wow. That's a problem. So let's discuss plans and money at the right spaces. The things that are about service delivery, the obligation of government, discuss it with government in terms of planning and budget, and work together. But when you take your own route, I'll not be surprised if there's an NGO constructing a school somewhere in this country and the Ministry of Education is not aware.
All right. Thank you very much, Mr. Elijah. I think I have to cut you as we take a short break. Then we come back and continue discussing on issues, data protection, which is also a very key and very important aspect that we need to discuss. And we also look at issues around what are the recommendations that we are giving, and how can we involve children in data collection.
I would like to take this opportunity on behalf of the governor and the county government to welcome you to the 4th ECD conference that will be held on the 25th of October 2021.
Welcome back. This is Child Rights Now. We are discussing issues children, and today we are talking about data, and to be more specific, data collection in Kenya in relation to children. And we are discussing with Mr. Elijah Bonyo in my far right from the Joining Forces Alliance, and in the middle we have Amy, who is from Miss Coach Kenya. So guys, the debate was a bit heated, and one of the things that I want to hear from you guys, sometimes you just have to stop complaining and maybe appreciate what you already have. What is it that is working that needs to be improved? Let me start with you.
Right, thank you. What I'm saying is the systems are there. They are right, yeah? Starting from the ministries, all the ministries. Case in point, they have technocrats, they have the best people they've employed. And they have the muscles, right? To disseminate and to devolve everything from their, from their offices down here. But you see, if you're getting it from, let me not use the word, if you're getting it from below, right? I know my needs. If you're seated at the high tower, you really know what I'm going through, right? So at that point of need, if you come down here and trickle this information, just as simplified as it can be, because even in data collection, it should be very simple. Don't complicate. So if from the chief's office, if the chief can understand that Ministry X, this is what they look at when in terms of collecting data. So if it's education, they know it's from the schools. So if the schools are around, they know very well that if I go to X school, I'll ask, the kids in these schools are this much. How many have transitioned from this point to this point? How many have fallen out from, continuation and transition of the education? Then when we go to the Ministry of Health, again, they will give us their simplified matrix. Don't complicate matrix, because when it's complicated, then it makes even people think fear, You just fear because you might not be able to interpret this. But when you make it as simple as ABC, and even the children themselves will be able to even fill in and say, I was filling in. So it is a tool that can be used at a higher level. So when we make our tools easier to be used at all levels, because we are solving the issues that are down here, we might be talking with, we might be saying high-level meetings. I hear people talk about, I'm at a high-level meeting, and I laugh. Who are represented at these high-level meetings? Only people with tummies, utambis,
Wow. Okay.
But the children or the people at the discussants, they are not there. They are not part of the equation.
So the question is high level for who? By who?
By who?
Okay, all right. So Mr. Don, what are the good practices that we have, or what is working?
I like what you said, that as people complain, we also need to talk about what's working. But who's complaining? The children are complaining. It's unfortunate that we are yet to get the children to the show, but if you got some children here, they'll tell you a number of issues. And let's not take issues being raised by children as complaints all the time. They're just genuine, and they're saying this is what is pushing us. We want this to be addressed. Planning is going on well through needs identification. So I can tell you, through the Ministry of Planning, National Treasury, National Bureau of Statistics, the numbers are there, people identifying the needs, so we need to strengthen our planning framework. However, the linkage of this planning to other ministries and interventions, that's where I think we need to do much more. Let me just try and give an example of what is working that then can be improved. And if you will give it a human rights or child rights based approach, we have the county commissioner in charge of coordination of national government in the county. Then we have the county children coordinator. The two of them, county commissioner is the chairperson of the area advisory council. The county children coordinator is the secretary of that council. So already what is working, there's already a framework for engagement on children matters. Now what they need to do, go down and ensure that the deputy county commissioner and the sub-county children officer, the area advisory council at sub-county level is working. Then go to the ward and make sure the area advisory council at the ward level is working. Then go to the location. Now don't meet at the county area advisory council before the meetings at the lower level have taken place. So the discussions around children matters and numbers at the location area advisory council. By the way, the chairperson at the location area advisory council is the chief. So the chief will chair a meeting at the location. Now the issues that they cannot address because of certain limitations will go to the ward where we have the assistant county commissioner, the former DEO. So the assistant county commissioner at the ward level, then we take these issues to the deputy county commissioner in the sub-county, the AAC, then you go to the county. No, that is a county arrangement. Every county area advisory council should tease out the issues that require the national level engagement. The national level engagement, we have the National Council of Children Services that should then take all these issues, analyze them, and channel them to the right national level institutions. So that's one way, if you want to look at children issue in the integration manner. But what do we have? We have the Ministry of Education from the school to education, right? Then you have another ministry up. So these intergovernmental platforms at the various levels, they already define clearly in guidelines and their functions. So that functionality is what needs to be strengthened.
So, so you've mentioned what is working, and what is not working. Now, I wanted to give you an opportunity to maybe give some of the recommendations you've given. That is actually, I think, some of the recommendations you've given. But before we give the recommendations, let's address a little bit about the safety around collecting data on children. What safety measures do you guys put in place when you're collecting data?
So first and foremost, data is confidential. The people trained to collect data, they have been trained on confidentiality, because as I'm talking to you, if it's a more personal question, actually all data is more personal, and if it's in your house, I shouldn't interview outside your house where it's not confidential. Well, that's a risk of, spilling of data and, the refusals in data collection. Someone will say, Stack, you're asking me, sensitive questions, right? So you also have to build confidence when you're researching. When you build confidence, how I come to you will already tell you if I'm a go-to person in terms of a relationship. So it starts from that point of interaction. So confidentiality starts from how I interact with you first. Then I have to keep my eye contact with you so that, we speak. I speak a lot, because if we don't relate in that way, then you feel like I just come in your house and start noting down, then you feel like, is this person investigating me or something, and I'm just writing things that I'm not asking you, then that is not ethical. It's ethically, morally right to seek consent before any data collection. In terms of seeking consent, that will also safeguard the data that we are trying to collect. You're not supposed to collect data on any child without prior consent from the caregiver or the guardian or the parent. If you do that, you're breaching. Yes.
So, can we say that like the data that you guys collect meet all those requirements?
Yes, because it's from the social from the children protection element, and it's also from the sub-county children's office. So we are not led by any. It's not from my end nor Bonyo's end, but it's from one center of authority.
And how do you involve children, apart from coming and asking children questions on data, or maybe extracting information from them? How do you involve them in that data collection process up to a point where you're going to analysis?
Remember, I talked about consent. Mm-hmm. So before even I get to that child, there's the parent. So I have to seek authority from the mother, who will say, okay, she's here, and I'm here to consent on the discussion. Mm-hmm. So I might not talk for the child when the mother is not there. So it is restricted that you have to seek consent first. When you seek consent first, then you have the moral authority to inquire on anything.
Yeah, I think Amy is running away from my question. My question, let me ask. Okay, yes, my question is, how do you involve children in that process?
I want
apart from asking them, getting them, seeking consent, and asking them the questions, how do you engage them from when you're starting to think about this is data that I want?
I still want to build on something I don't want us to lose. We have the Data Protection Act. So that's another whole discussion. So it's important for the public to know there's a data protection law in this country. And we have a data commissioner. It has principles and many things. So that is another thing. The same way citizens were educated in the Constitution, we need to educate citizens on the Data Protection Act. It's a whole discussion. But back to what Amy is saying. You are asking, how do you, who? You see, the question is, we as who? Are you looking at we as
a data collector?
Very important question. Data collector is an agent of somebody, right? Anytime you hear people called enumerators, research assistants, they are simply hired to go and collect data. But before you arrive at collecting data, who wants the data? So the question as to how do you involve children, let's start from who wants the data, and unless you design how you are going to involve children, Amy is very right. You should be looking at how do you involve children in the design of the data collection tools, for example. But that's a question that depends on who is designing. Let children, for example, when we are doing data collection on census, national census, do we get children to give their views on what parameters should be collected? Then that parameter will be collected. So there's involvement of the design. And there's involvement as a participant or as a respondent. Now, in this country, most of the time, children are involved as respondents. And there's very minimal involvement at the design. Right? So when you go down to involving them as respondents, she's very right. There's this, the child safety or safeguarding concerns. Now, when you come to me in my household, you want to talk to the children. You need to explain to me why you want to talk to the children. You never know, I might be the right person to explain to the children why you want to talk to them. But what do other people do? You push me to stay aside, and you want to imagine you will explain to the children better than me. So we also need to allow parents to pray their role. Let caregivers pray, because at the end of the day, you collect the data for 1 hour and leave the parent and the children. Then the parent begin to ask, so what was it? And they told me not to tell you. So the most important thing, let's not separate the child from the caregiver or the parent in as far as involvement around data is concerned. Explain to the caregiver, explain to the parent the information you want to collect, what is going to be used for. Let them agree that this is important, right? Then, if you as a person collecting data, you already have an imagination that certain things children will not say if the parents are. Okay. Now, where is the engagement? Why don't we just ensure that the parent and the children are free to engage, unless it's a criminal issue, unless it's a criminal offense, crime has occurred. If crime has occurred, then you need to separate everyone who you need to take statements from. But if you want to solve the food security situation of a community, you want to solve the water situation of a community, you want to solve the education situation, why don't you have, I'll be happy to see a day we have a focus group discussion of children and parents together. And why must you come to my household? I'll be happy to see a situation in this country where I give the data by myself from wherever I am. The cost of you moving to my household can be solved by ensuring that you enable the public to give the data by themselves. For example, all those basic questions, put it in an application in the mobile phone, and just say that on Mashujaa Day, all Kenyans, we have set this question, you go and respond. Now people do not have access to phone calls. You arrange, they go to the chief's office and everyone is assisted to respond. One day, the entire country has responded to basic questions. Then you analyze. Those are the solutions.
It's good you've mentioned.
We are going to have people suffering from what we call data fatigue. And the big culprits, by the way, is the non-state actors. Government hardly collects data every day. Today NGO 1, tomorrow NGO 2, tomorrow another NGO in the same community. I think it's a problem.
Yeah. Wow. So because of time, I want to give you guys 1 minute each to conclude on this subject. I'm sure we've exhausted quite everything that we wanted to discuss today. I want to hear from you, Amy. Give us your final remarks.
I'm happy from where Bonyo just mentioned.
Yes.
Fatigue,
Seems you have an experience.
Yes, the data fatigue. Because, non-state actors differently would want to get information by shortcuts. By giving, if I give you money to collect data from you, I'm buying your information. Did you know that? You don't need to buy information. So many of our colleagues are doing that. So when you come in and as maybe you're doing it on behalf of the government institution, quote in quote, they'll say, you so and so came here.
Give us.
They collected data, the same information. They gave us money. They gave us 500. What are you giving us? So already you've compromised, and which is the wrong thing that we are doing. As is said, you only have to voluntarily give your information to the right people. Don't just give information. You're told not even to give your ID to any strange number that is calling you other than not Safaricom, right? So if someone tells you, if you get information from the chief, we need this information to know if there are any problems either with malnutrition within this community, then you have to give it voluntarily. But when you say we need an incentive so as to give you information, there is a problem.
Right. How about you, Mr. Bonyo? 1 minute.
Do a survey and ask the children, how would you like to be involved in data collection and analysis? You can do that as your institution, or you can go back to partner with government, because this question of children involvement, it's important that we give the children a chance. Let us not purport that we know how they want to be involved. I think let's have the right institutions in government, in collaboration with non-government, to first of all ask children, if we were to collect data about your rights, how would you want us to collect it? Some of them will tell you, don't sample us, do a census. The children will tell you, we know you come here, you know we are 1,000 this school, then you sample us, and you make a conclusion that this is a representation. They might shock you and say, don't sample us, do a census, because in our interest, we like every child to be heard. Thank you.
Wow. Thank you very much, everybody. This has been Children Rights Now, or Child Rights Now. We are discussing issues children, and today's discussion has been amazing. I'm so happy that you've tuned in up to this moment. My name is Colin Sorono. See you again next week, same time, same place.